Hello there. Well, if you've been wondering why you just can't do well in the OET Listening Part B, I'm going to help you and give you some strategies to help you do as well as you can in the OET Listening Part B. And I want you to think about what you actually find the most challenging part of this particular subsection of the OET. If it's something like my students who tell me that the answer options are so similar, perhaps there are two which are really similar to each other, and they just kind of get stuck between these two options, or they just kind of run out of time and then they miss the actual recording, then this video is for you because hopefully I'll be able to guide you with some really useful strategies, really simple strategies as well, to help you do much better. So we're going to look at three key strategies to help you overcome these problems. We'll then do three little listening practices, so you get a chance to listen, put these strategies into practice, see how you go. And of course, we will look at the answers as well, so you can see if you are getting these right. My name's Sona and I'm your online tutor with Bose Learning. I'm a premium preparation provider of the OET. Thank you for upgrading your OET with us. Okay, let's get started then. And what are these three things you should be doing in listening part B in order to fix all these problems? Well, the first thing sounds really obvious, but what you should be doing is reading the question and the options before you listen. So, yes, it's an exam and you might be panicking, but please try and read the question and the options. And when you read them, these are the kinds of things that you should be thinking about. Who is going to be talking? So, who are you going to hear? And who are they going to be talking to? So, to whom are they talking? Then you've also got to think about how many people are you going to hear? Are you actually going to hear two people, for example, in a handover, or just one person talking? And why? Why are they talking? Why is this audio extract actually taking place? And this leads me on to my next strategy for you, and that's to really understand the purpose and the focus of the question. What do I mean by this? Well, there are four question types that could come up in the OET listening part B. What are they? Do you know what they are? Well, the first one is gist. And if you get a gist question, you need to focus on the main topic or the outline, the whole extract in total. What is the key topic of this extract? You might get a question which looks at detail. In this case, you've really got to train your ear to listen for something specific. You are really listening for a specific piece of information, and this is kind of connected to the next one as well. So in this case, listen particularly for what is going to be done. That is a specific information in the future, what should be done as a consequence of listening to the extract. The final kind of question you could get is a purpose one, and that looks at the reason for doing something. So, why is this extract happening? Of course, it's an exam, but in real terms, what was the reason behind this extract? If you can understand these things, you can really focus on the information, and this will lead on to the next one, which is the most important strategy, and that's to listen for ideas, not just synonyms, because there are going to be distractors. They're going to be paraphrases, and you think, oh, this is an exact match of this word, so it must be this option. But no, try and justify why is it this. Listen for the idea, not just the synonyms, and don't get distracted by distractors. That's what they're there for. They're there to distract you. So think about what you're focusing on, think about what the question is asking you, and listen out for that, not just trying to match things. Okay, let's have a go, and we're going to hear three extracts now, and we're going to try and work through these strategies in the first two, and then the third one you can have a go by yourself. So, question number one then. You hear part of a talk by midwife to new mothers. Okay, so here, this is the context. We've got a midwife to new mothers. How many people are talking? Well, probably just the midwife. You might hear a mother asking a question and then the midwife replying. And the question that you have to focus on is, what is the purpose of this talk? So this is nice and easy. Which one of these four question types is it? It's purpose. So please try and listen to the whole extract before you choose your option. I've deliberately taken the options out up until now because at this point you should just be focusing on the context and thinking about these few things. Once you've done that, you can look at the different options. And we have here to explain, so remember it's the purpose, to explain how the baby's cheeks work to suck in milk, to describe signs to show a baby is feeding correctly, or to tell a mother what to do if the baby is not comfortable taking milk. So we have an explanation, a description, and some advice here. So is it about how the baby's cheeks work, to describe these various signs, plural, or to tell a mother what to do if the baby is not taking milk comfortably? Okay, let's listen and see if you can tell me which one it is.
The baby's suckles get deeper. You actually see them taking great big drinks of milk. And to know that they're actually feeding correctly and latched on properly, they should have rounded cheeks, not sucked in. They should be comfortable and contented at the breast because they keep coming off. They're probably not latched on properly. It should be comfortable for you and the baby.
Okay, how did you go? So, really, the answer is B, to describe the signs to show a baby is feeding correctly. This is why I said don't just listen to the first thing and put down the answer. Listen to the whole extract. Because she does talk about the baby's cheeks, but it's not really the purpose of the talk. The purpose of the talk is broader. It's just to show the various signs that the baby is feeding, and it's not really to tell the mother what to do if the baby's not comfortable. Again, she just says if the baby's not comfortable, then obviously the baby's not latched on properly. So this one here was option B, which is what you should have shaded in. Okay, let's take a look at the next one together. And this time the context is you hear a public service advert from the NHS. So here we have an advert, so probably just one person talking. What does it advise patients to do if they have a persistent cough? So again, out of our four options, which one do you think it is? Well, we can kind of narrow it down to course of action. What should they do? Of course, you're listening for the detail of this as well, but really it's what should they do after they've heard this advert. So very specifically, you should be listening for what the patient should do. So there might be lots of other things involved in this as well, but you're looking for that key bit of information. What should they do next? So we've got our options here. Assume it's nothing, contact and contact. So we have two contacts and one assume it's nothing. Try not to worry. So let's take a look at the differences here. We've got assume it's nothing and try not to worry. So is the main message that they shouldn't worry? Or is it to contact somebody, in which case, who should they contact? Should they contact the specialist or their GP? Don't assume anything before you listen. Listen to everything and then try and answer. Here we go.
If you've had a cough for 3 weeks or more, it could be a warning sign. It's probably nothing serious, but it could be a sign of cancer. Your NHS wants to see you. Contact your GP practice.
Well, the answer is, of course, that they should contact their GP, not the specialist. They say it's probably nothing to worry about, but they shouldn't assume it's nothing serious. They should get help from their primary care and their GP. Okay, the last one, please have a go at this yourself. First of all, I'm going to give you some time to go through our strategies and then listen, and then I'm going to give you the answer. So 1 minute just to look through by yourself. Okay, here we go.
Hello, my name is Matin Kim. I'm a consultant in acute medicine and the National Clinical Director for Infection and Deterioration. Your health professional has given you or your carer a pulse oximeter to use at home. They may have also asked you to use a paper diary or smartphone app with the pulse oximeter. This is because, when used together, these are helpful in monitoring your condition and your recovery from COVID-19.
And here is the answer. Of course, it's to explain why they've been given an oximeter. It's not to explain the importance of this. Yes, they've been given this oximeter because of COVID-19, but actually it's about the recovery from it, not monitoring the symptoms. He does introduce himself, but that's not really the purpose. It's not the reason why he records the message. Well, I hope you found these strategies useful. Thanks very much for watching. Why not watch one of my other videos? There are over 180 OET videos for you to watch. And if you liked this, I would be so happy if you could help me grow the channel by pressing that like button, subscribing and sending this to a colleague. You can also join me for, if you are on Telegram, for a regular dose of all things OET, or sign up to our newsletter. Thanks very much for watching. Take care. See you next time. Bye bye.